4 oxygen concentrators, pulse oximeters, washing machines, cotton rolls and other hospital equipment were completely destroyed by floods.
The floods came with a lot of mud and it submerged the hospital. Most of the wards were submerged.
The hydropower turbines and hospital standby generator were submerged, leading to a power blackout and the death of 2 premature babies who were being monitored in incubators.
Because of power, lack of power, we couldn't run oxygen. Some patients who are on oxygen were affected.
The condition of many of the patients is in a precarious state, as those with infectious diseases like TB are sharing the same ward. Health workers at the hospital are currently working to clean up affected hospital wards and drainage system. Alex Kakama, the hospital human resource coordinator, says there's need to create a big drainage channel and has appealed to government to help replace the damaged equipment.
The floods destroyed our plumbing systems, so the water supply to the hospital was cut off. We are now trying to install the water system. We need help, definitely. We need help. Maybe the government can come in to help the hospital.
The hospital receives more than 500 patients each day and carries out 120 deliveries per month. It was founded by Anglican missionaries in 1958 and also serves as a training center for nurses, midwives and doctors.